Good evening all, I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, the voice of our community. We are coming to you from our studio here in New York City. Here is what's happening tonight in the coronavirus pandemic. In the United States, we hit a bleak milestone surpassing 3 million coronavirus cases in the country, accounting for 25% of global COVID-19 cases with at least 131,000 deaths. Cases are rising at a record rate in 35 states, with yesterday being the highest single count with more than 60,000 COVID-19 cases. States Florida, Texas, Arizona, and California are setting grim records, reporting alarming increase in hospitalizations and patients requiring intensive care. Federal authorities have responded to an increased demand for coronavirus testing by adding a short-term surge testing site in 3 metropolitan areas in Florida, Louisiana, and Texas. This surge in cases has forced authorities to also backpedal on moves to reopen businesses such as restaurants and bars, with at least 24 states now pausing or rolling back their reopening plans. Once the epicenter and the hardest hit with COVID-19, states New York and New Jersey are trying to preserve their progress they have made in controlling this virus in the face of its resurgence in much of the rest of the country. Many states are now requiring use of masks in public areas, and on that, top health official Dr. Anthony Fauci has said that when you look at what we can do, that we know which works, it is the use of masks, physical distance, and avoiding crowds. He said that the signal should be wear a mask, period. If you are in states surging with COVID-19 cases, please remember to abide by CDC guidelines and take all preventative measures needed to ensure your safety and of others around you. Also, reach us on events@itvgold.com if you are a South Asian medical worker on the front line or an owner of an essential business running in hotspots of coronavirus. On the show tonight, we have much on the ongoing COVID-19 updates featuring South Asian doctors, along with elected officials on the impact of COVID-19 on communities across the nation and their take on the ongoing Black Lives Matter movement. Here are the headlines. Brooklyn Borough President Eric Adams addresses COVID-19 impact, reopening, and Black Lives Matter, New York City. Dr. Suresh Reddy on rising COVID-19 cases, hotspots, and universal masking, AAPI, Chicago. Mayor Sadaf Jaffer addresses coronavirus response, reopening, and systemic racism, Montgomery Township, New Jersey. It's time for a short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I'm Aditi Lama, and this is Vision of Asia Wednesday night episode. We have tonight much featuring elected officials and medical professionals on the coronavirus impact and measures. With that, let's now take a look at our New York City exclusive conversation with Brooklyn Borough President Eric Adams, who joined us recently by a virtual conversation. In New York City, there have been more than 200,000 cases with at least 22,000 deaths. Reflecting much on the trajectory of COVID-19, the borough president provided much insights on reopening phases of New York, as well as his comments on the surge of cases across the country and the actions of New York City to contain the spread of this virus. Looking at real recovery process, Brooklyn Borough President Eric Adams also discussed several economic and healthcare reforms needed in the Brooklyn Borough, while also addressing racial disparities seen in Black and brown communities during COVID-19. Here are some highlights from the interview where Brooklyn Borough President Eric Adams also showcased his support and passion for the ongoing Black Lives Matter movement for racial justice and equality. Here is the story. We are still moving ahead in reopening phases, while the rest of the nation, about 31 states, are seeing a spike in COVID-19 cases, with 24 that have paused or rolled back on their reopening. What is your comment on what is happening and its impact on New York, and how important is it for us to sort of monitor this reopening in the city?
Well, I believe that you're seeing success in New York only because of New Yorkers. One thing about us, we have gone through tragedies before, and we always respond according to those tragedies. After September 11th, there was a real call of see something, say something, and New Yorkers did just that. We know how to follow directions. When you live in a close confined community in a city like New York City, where following instructions means a lot, this is something we're used to. And when the call was put out, face coverings, when it was put out, social distancing, and even shelter in place, many of us followed those orders, no matter how busy our city may have been at the time.
Yes, definitely. In terms of looking at these cases that are rising in other states, Brooklyn Borough President, are you concerned about New York and another surge of cases here due to the other states that are showing increase in cases?
Yes, we are, and I believe the governor and the mayor talks about those who are visiting, particularly those hot spots, those locations where you're seeing increases like Florida, California, Arizona. We have to be extremely conscious and ensure that when people come here, that they really shelter in place for a period of time, because we don't want to go back to where we were at the peak of this pandemic.
Yes, you know, this brings me to a very important discussion on racial disparity and its impact on the Brooklyn borough itself. What communities have been impacted the most? And when you're looking at this disparity, how intense is that impact in Brooklyn?
It has been, Brooklyn has been hit extremely hard. New York City, as you know, was the epicenter of the coronavirus pandemic. Brooklyn was the center of that center. The first death took place in Brooklyn. Some of the largest number of cases happened in Brooklyn. And when you look at what happened at the beginning of the virus, we did not give the proper resources to Brooklyn. We failed to properly analyze our resources and make sure that there was an equitable distribution, and what I like to say, in real time. And I think because of the slow response on the state and city level, there were some serious problems that led to a high number of hospitalization, and even in some cases a high number of deaths. It's unfortunate that the virus did not discriminate on who would actually catch the virus, but we had clear discriminatory processes on how we protect the people of the city. And I think it was a bad decision to divide the city into essential and non-essential employees, because we sent the message that some New Yorkers were more important than others, and that should have never happened.
You know, just on education, just one question I had. Today, ICE announced a big ruling towards international students, and they're saying that if they don't go back into an in-person school, they may not be allowed to live in the country. Is there any comment you have on ICE's announcement?
A bad decision, wrong decision, and we can't allow politics to get in the way of education. Clearly, this is a political stunt. I believe it's imperative the young men and women who study at our academic facilities play a vital role in the actual functionality of this country. We are who we are because of our diversity and all of the ideas that come here. People come here because they want to be part of the American experience. And while they're here in school or while they're here in being employed, they contribute to this country, and we need to continue to allow them to continue their studies, either online, remotely, or inside a classroom.
Yes, for sure. Well, thank you so much for your time here on ITV Gold, Brooklyn. Looking at the coronavirus cases and its impact, the global number of COVID-19 cases is nearing 12 million, with at least 545,000 deaths. In the U.S. today, we surpassed 3 million COVID-19 cases, quite a sobering number, and the cases continue to rise alarmingly in 35 states, threatening to reverse progress made during weeks of shutdown and stay-at-home orders. States such as Florida, Texas, and Arizona are hitting record number of cases, with issues of ICU availability and lack of ventilators impacting some states more than others. So what is required from all of us while more than a dozen states see a spike in cases? And how important is wearing a mask, practicing social distancing, and washing hands? We spoke to Dr. Suresh Reddy, president of the American Association of Physicians of Indian Origin, AAPI. He joined us virtually from Chicago, highlighting important details and measures on COVID-19 and its growing impact. Urging all to understand the seriousness of this pandemic, Dr. Suresh Reddy called for universal masking, addressing the importance of a mask in preventing the infection, and also spoke on the nation's reopening. A very informative discussion with facts. Here is Dr. Suresh Reddy. Now, Dr. Reddy, so much has happened in the nation. So my first question to you has to be reopening. Did the nation reopen too fast? And in terms of looking at what is happening across 31 states that are seeing an increase in their coronavirus cases, as well as 24 states who have paused their reopening, what is your medical opinion on this?
So there are three-prong approach to this problem. The problem is, one is the governmental side, second is the physician side, and third is the population, the public, general public. And from the government side, they have to look at a complete picture, not only healthcare, but economics and for the social life and the way the life is. And they have multiple factors they have to look at. The physician side, yes, as a physician, I think it's too early to think we already won this war. We have ways ahead. There's at least another year of very cautious approach from the physician side. From the public approach, it's the public also, they should understand this is a serious disease, and they can control themselves. They should be able to, just because government makes the rules strict or lax, they should also do their part of the share. So this is a three-prong attack, and as a physician, I think we are too aggressive in opening up, and I think we have to be extremely cautious for at least another year.
In terms of looking at the South and West, which are getting impacted now, before it was New York City where we're coming from, what do you think is the reason behind such a surge in cases in the South and West as we speak right now?
So when the first virus hit New York and sparing the southern parts and the hotter countries, especially Africa and some parts of India and all the southern states, we thought maybe the temperature is stopping this virus. So we thought once the summer kicks in, this virus will go away. But because they use like a strict preventive measures such as universal mask, lockdown, and physical distancing and good hygiene, they were able to control in New York. But interestingly, I think looks like the virus mutated and changed its shape and course, and now it is hitting the hot areas, especially Florida, Texas, California, and even in India, it is becoming rampant. So, and the preventive measures were not that strictly implemented in the South. Then in the North, as I said again, this is a three-prong attack. The public also has a huge role to play in controlling this disease.
In terms of testing capacity, looking at both antibody testing and COVID-19 testing, do you believe we're doing enough at this point? I know testing was an issue before. And in terms of, if people want to get their antibody test taken, do you recommend it?
So testing is a very complicated issue. First of all, do we need to test, not test? How many should we test? Because the more we test, the more positive we get. Instead of that, they can just do a sampling in one community and say, okay, or like take 3 or 4 tiers of communities and say, okay, in this community, when we tested 100, this many are positive. And you can extrapolate those numbers instead of testing each and every person. I think testing should be limited to people who have, who are having symptoms or who are going other medical procedures. Because the more we test, the more we get positive, and we don't know where to go. So we have so much, we'll get information which is not really helpful. So instead of that, they can use the mathematics and say, okay, this is the projected number of positives, this is the projected number of negatives. But again, this testing is also interesting because This virus is interesting in the sense that before you even get a symptom, you are already spreading the disease to multiple people. Most of the diseases, once you get symptoms, that's when you will be spreading the disease. But this one, you spread the disease first, then you get the symptoms. So it's a little bit complicated with this. So testing, I don't really, I cannot rely too many medical decisions on testing. But the most important thing that's important is first they have to do with the help of statisticians. We can check, we can find out how many people will be positive in each city or each region, extrapolating the mathematics. But the most important thing is how many people are getting admitted in the hospital, how many are symptomatic, and how many are getting severely critical. These are the three numbers that's most important.
What are your comments on testing? Sorry, my bad. There's a little error. What are your comments on drug trials as well as vaccination? Because with so much confusion with testing and other forms to protect ourselves, it just seems like we all have to wait for the vaccination. We also keep on hearing about random drugs that are being experimented at. What kind of insight could you provide us for that?
So there are two things, testing and vaccinations. Testing, again, because we are doing it in a rush. Usually the testing takes months and months and experimentation and at multiple stages of experimentation, then it released in the market. Because we are on a time crunch, we don't have enough, it's like going to an examination without proper preparation. So you skip several of these steps to save time. That's part of the reason we are not able to get a good test, which can be 100% sensitive and 100% specific. The same thing with the vaccine. Usually a development of a vaccine takes anywhere from 6 months to 2 years or 3 years, or sometimes 20, 30 years like HIV. We don't have a vaccine yet. So we are rushing and we are pushing the people to the scientists to make the vaccine so fast. 60 to 70 companies are working on this vaccine. So this makes it's a little bit harder to get the good vaccine. So they are coming up with homework which is not completely done. So it will take a while, and rushing is good, but too much rushing produces bad products. That's what's happening right now. So I'm thinking it may take at least another 6 months or a year before we really get a good vaccine.
Oh wow! So do you predict this vaccine to be available in January of 2021? I believe Dr. Anthony Fauci had said that he was hopeful to have something by then.
Yes, we are hoping, but hope is hope. Reality, I think it takes longer than hope.
Ask you what your prediction for the next few weeks is. What would you say?
The number of cases has increased in the southern states, and it takes 2 to 3 weeks before they get admitted in the hospital. Some of my friends who are physicians in those states are saying all the ICU beds are full. That means now they are in the second phase. So basically, the cases increases. That's the first phase. Second phase, ICU beds increase, and the third phase is some of them become critical, and the fourth phase is some of them get expired. So we are in the second phase. So we'll see again increased number of critical patients and increased number of deaths. But I think it will be definitely less than the New York, because at least we know what to do, what not to do, a little bit better than 2 to 3 months ago.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Continuing our report on the coronavirus pandemic impact and measures, let's now take a look at the state of New Jersey. The state has surpassed more than 15,000 deaths and has more than 200,000 cases. Today, New Jersey Governor Phil Murphy announced that the state will now require people to wear masks outdoors in public when they can't practice social distancing. This comes as the nation has topped 3 million cases, with about 1 million coming in the last 28 days, as numerous states have seen a surge in new positive tests. The state, which was once a coronavirus hotspot, is now monitoring the rise in other states and is requiring travelers from 19 new hotspot states to quarantine for 14 days after arriving in New Jersey. Much on that and the impact of the ongoing phase 2 of reopening, we have tonight our exclusive with Mayor of Montgomery Township in New Jersey, Mayor Sadaf Jaffer. Mayor Jaffer spoke to us on the ongoing COVID-19 measures in her township and the impact on the South Asian Americans as well as the immigrant communities of New Jersey and her view on the New Jersey leadership in combating COVID-19. Also addressing the Black Lives Matter movement, the mayor provided her perspective on systemic racism in America and anti-blackness, urging all to exercise their right to vote this year for racial justice and to get our voices recognized. Here is Mayor Sadaf Jaffer. Good. You know, there's so much to discuss here with you. I have to start this interview asking you one of the biggest questions that pretty much every American is asking: reopening and its status. Where is New Jersey in its reopening and where is your township? And with the surge of cases that we're seeing, 31 states are increasing in their COVID-19 cases. 24 states have paused their reopening. Where are we standing in New Jersey?
Well, New Jersey is doing pretty well as compared to other states. We had one of the worst outbreaks early on, but we responded as quickly as we could. And now the rates are relatively low, and that's why the governor has been allowing for more opening to take place. That being said, we are seeing some more increases in the cases lately, a slight uptick. So I know that the governor is looking at that very closely. We in the township, there were a few weeks in a row where we had no new cases. And now I would say over the last 2 weeks, we had about more than 10 cases. So, I mean, it's not an explosion by any means of the imagination, but it's definitely concerning. And we have to make sure that everyone is going by guidelines and even beyond that, really thinking about how necessary it is for people trying to limit that.
Yes, definitely. Let's talk about your township real quick here, because I have a lot of questions on how Montgomery Township is handling the COVID-19 crisis. What have been some of the biggest measures you've had to take in order to combat the economic ramifications as well as the healthcare crisis that we're seeing in the entire nation? Sure.
Well, Governor Murphy always says that economic health has to come from public health. And I completely agree with that, the economy can only be strong if all of us, the public, are strong and healthy. So, our initial response was all about making sure that we were cutting back on people's face-to-face interactions. When we closed the municipal building, the township closed its public schools, and then the governor obviously had all of his orders to close down businesses and playgrounds and parks and things of that nature. So I think it's a cautious approach where we slowly have been opening along with the guidelines from the state, emphasizing the importance of masking, working with our businesses to make sure that we help them adapt, whether it is by working with them in creating outdoor dining facilities where they might not have had any before. And it's kind of interesting. It's given our town a little bit of a European look with all these terraces and outdoor booths. So there is something nice about that, and seeing people, definitely you see more people walking outside, biking and things of that nature than you would have before COVID. So trying to help people enjoy the outdoors and local parks and places like that to entertain themselves and to find some peace and recreation.
Yes, definitely. In terms of looking at then racial disparity, which communities would you say have been impacted by that the most?
Well, there has been a focus on the Black community and the Latinx community in terms of high infection rates and then high death rates. And that has to do a lot with the social indicators of health and the fact that people are more in service professions where they might be interacting with people. They might work in essential businesses that didn't close down even at the height of the pandemic, whether it's, in medical care or, grocery stores or other places that people were frequenting. But it also just has to do with the health disparities that exist in our country, where minorities, particularly Black and Latinx communities, do not have the same levels of health care, might not have a regular doctor, might not be able to afford to take care of their health or have their health looked after in the same way. So that's one certain indicator. But I think especially with our communities, with the South Asian communities, high percentage of medical professionals, it's definitely hit our community very hard as well.
Just one last message to our audience, and I would love for you to give a message to all the young South Asian Americans watching you, especially.
I would say I really feel for you. This is a very hard time to be a young person. I think it's probably the hardest for high school and college students than it is for anyone else, because this is, traditionally a time for you to be independent, for you to be exploring different things. And unfortunately, we're all kind of locked up at home for the most part. But I would say that, life is long. There are a lot of opportunities. Right now, we really need to focus on our health. So please mask up, wash your hands, keep physical distance, and get involved in the political process. Make demands for what you want for your future, because the decisions that are made now will impact your lives more than anyone else. So definitely get involved, and we need you, and we want to hear your voices.
Yes, definitely. Well, thank you so much for your time here on ITV Gold. I wish you and the Township the best.
Thank you so much.
Of course. And this wraps up our show for tonight. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com, or you can also follow us on Facebook @ITVGold. Also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.